Hi, today I'm going to guide you through a few exercises that I typically give, exercises and stretches, to patients or clients that present with sciatica or nerve entrapments that mimic sciatica. And so sometimes the nerve will be entrapped from your psoas major, which is your deep hip flexor and your primary hip flexor. And oftentimes it can get entrapped in your piriformis, so in your deep lateral rotators, or in your hamstrings. So these are a few things that I like to show. This will take about 5 to 10 minutes. So first, the most simple one is in a seated position doing a figure 4 stretch. So you are going to take the affected leg and cross the ankle over the non-affected knee. The goal is to have your leg parallel with the ground. You might be starting with your knee way up, which is totally fine. You're going to breathe into this and then slightly rotate your body towards that knee, and keeping your back very straight, you're going to lean towards that side. I don't suffer from sciatica currently, but I can already feel a stretch in my gluteal region, which is what you're looking for. You're going to breathe into this position. You want to do at least 6 deep breaths, and that's enough. You can do both sides and also check both sides to see the difference between your right and your left, the affected and unaffected side. Another gentle stretch that I recommend that will help target your hamstrings is in the stairs, because you can hold on to the railing. You're going to lift one foot and you're going to keep the knee straight, keep your back straight. You're going to lean forward until you can feel a stretch in your hamstrings, so the back part of your thigh. And then in this position, you're going to rotate right to left. You have to think that your hamstrings are 3 muscles, and the adductor magnus is considered the 4th hamstring. And what happens is sometimes they get stuck together. So when we're doing this, we're enabling movement between the different muscles, letting the nerve slide through, get a little unstuck. When you find a sticky part, you can hold it for a little bit. Make sure that you're breathing through this. Notice my back is straight. If you're rounding, you're missing out on some of the potential stretching, and my knee is straight. You can also point your toe away from you and back. This is one level of nerve flossing that you can do. You can also do it seated. So on a seated position, if your knee bent, your hip bent, and eventually straighten your leg, and you can point your toe up and down. If that's too intense, you can bring your chin down and back. None of this should be excruciatingly painful. You should be able to breathe through all of this. That's very important. Now, you can also do some gentle glute bridges after you've done some of these stretches. So, lay down on your back with your heels about finger length distance, a little wider than hip width apart, and you're gonna tilt your pelvis back, so basically flattening your low back onto the ground, so tilt posteriorly, and then pushing into your heels, you're gonna drive your hips up, holding for 3 to 5 seconds, and then come down with control. You should feel the activation in your glutes, and you don't want it to hurt. So come up and down, up and down. Now, to release your back, you're gonna do some cat camels, rounding your back up, and then letting your stomach come down and looking up to the sky. You want to do a few of these. It should be pain-free. And then what I'd like you to do after this is do a few bird dogs. But I want you to start with the most basic version. And so to make sure that you're doing it correctly, I recommend using a feedback mechanism. And so a really simple one is using a ball. You're going to place the ball on the bottom of your low back so that you know that your spine is staying neutral. You're going to stay in the same quadruped position, nice and high between your shoulder blades. You're looking about 3 feet ahead, so your spine is in line, your cervical spine is in line with your back. And you are going to take a breath in. Exhale as you reach up with your hand, bringing your arm to ear height. Take a breath in, and exhale as you bring your arm to hip height. And then breathe in and repeat. Notice that my hand passes right under my shoulder without catching the ground. It's because I'm staying nice and high on my hands. So these are a few exercises that I recommend. However, make sure that you run this through with your doctor, your physiotherapist, your physical therapist, massage therapist, all the practitioners that you're using. And if this keeps getting worse, it's really worth seeing a practitioner if you haven't already seen a practitioner. I hope this helps. Have a great day.